This is replacement of upper first and second molars in a patient with a minimal mouth opening. This case was done flapless. This patient opened about 40 millimeters, about 2.5 fingers. Her vertical clearance posteriorly was about 30 millimeters. When you start running the math and you look at the drill length was 34.5. The vertical requirement in that particular handpiece was 37.1. Fortunately, maxillary teeth have a buccal cant, as mandibular teeth have a lingual cant. And so I was able to bring the handpiece a little bit to the buccal and still be on line with my trajectory to pick up the extra few millimeters I needed in order to do the case. So we made a pilot hole. I inserted at an angle as seen in the top right panel, swung vertical, and drilled the depth. And you can see the position on the right side through the occlusal view of a guide pin. I used a tissue punch, and this was a low-density case. So I enlarged the diameter of the osteotomies using an osteotome. And in the lower left panel, you can see that you can use the osteotome through the guide in order to not distort your trajectory. In the center panel, you can see the position of the osteotomies, and then the implants were inserted through the guide. Again, this is maxillary bone, very easy for a self-tapping implant to get off track. So we use the guide the guide hole for the implant insertion. And here's the completed case, and you can see the views of the implants are in rather ideal position and made for easy restoration.